You survived the heart attack, but now comes the real challenge getting your life back. So where do you even begin? Maybe you're sitting on the edge of your bed right now, staring at the pill bottles lined up on your nightstand. Maybe the silence in your home suddenly feels heavier. Or maybe you're wondering if you'll ever walk around the block again without feeling that tightness in your chest or that whisper of fear in the back of your mind. First of all, take a breath. You are not alone in this. Every year, more than 800,000 people in the United States have a heart attack. Many of them, just like you, go on to live vibrant, meaningful lives. But there's a crucial window of time right now where the decisions you make can shape how well you recover and how confidently you move forward. In this video, we're going to walk through 5 powerful steps that can help you reclaim your strength, your health, and your peace of mind after a heart attack. And make sure you watch until the end, because I'll be sharing a powerful 2-minute practice that many heart patients say completely change how they sleep, breathe, and even think. Let's start with a step that's often mentioned in passing, but rarely given the attention it deserves: cardiac rehab. Now, if the words cardiac rehab make you picture a sterile room with exercise bikes and clipboards, I want you to toss that image out. Let me tell you about John, a 68-year-old retired firefighter from Michigan. After his heart attack, he was skeptical. He said, "I've been running into burning buildings for decades. I don't need someone to teach me how to walk on a treadmill." But after his second week in the program, something changed. He wasn't just moving his body, he was learning about what his heart needed. He was gaining confidence. He even made friends in the group who were on the same journey. And 3 months later, John was hiking trails with his grandson again. That's the power of cardiac rehab. According to the American Heart Association, people who attend cardiac rehab are 25% less likely to die from a second heart event than those who skip it. Let that sink in. That's not just a statistic. That's more walks, more holidays, more laughter. It's time you get back. Cardiac rehab isn't just about exercise. It's a supervised program that helps you heal physically and emotionally. You'll work with a team, nurses, dietitians, physiotherapists who specialize in heart recovery, and they'll tailor the program to you. So if you've been afraid of overdoing it or unsure how to start moving again safely, this is your answer. If your doctor hasn't already referred you, ask them about it. Push for it. You deserve it. And Medicare covers it for eligible patients, so cost doesn't have to be a barrier. Now, once you're moving in the right direction with rehab, there's another piece of the puzzle that can't be ignored: your medications. Let me be honest, this is where a lot of people stumble. Not because they don't care, but because the bottles pile up, the instructions blur together, and maybe you start to feel okay and wonder if you still need all of them. But here's the truth. Those medications aren't just about today. They're your shield for tomorrow. Let me introduce you to Carmen, a 74-year-old widow from Arizona. Carmen felt fine 2 months after her heart attack. She thought she didn't need to keep taking her beta blocker anymore. "It made me a little tired," she said, "and I figured my heart was healed." Then one morning she collapsed in her kitchen from a sudden arrhythmia. Thankfully, her neighbor found her in time. But Carmen learned the hard way that these medications are not optional, they are lifelines. Research from the Cleveland Clinic shows that up to 50% of heart patients stop taking at least one of their prescribed medications within the first year. That's a dangerous statistic. These medicines, like statins, ACE inhibitors, blood thinners, and beta blockers, each have a role. They lower your risk of future heart attacks, strokes, and even death. And here's a tip: if side effects are bothering you, don't just stop taking the meds. Talk to your doctor. There may be an alternative or an adjustment. You're not stuck. But going off them without guidance, that's like removing the airbags from your car before driving on the highway. Set reminders. Use a pill organizer. Ask your pharmacist to synchronize your refills. Whatever it takes, treat these meds like the seatbelt for your heart. You may not always feel them working, but they are. And if this is resonating with you, I'd love for you to comment with your age or where you're watching from. It's a joy to know we are walking this path together, and your story might inspire someone else who's feeling lost today. Now that we've laid the foundation with these first 2 critical steps, we're just getting started. Because there's another piece that's often overlooked, even though it can be just as life-saving as medication. Let's talk about something more personal: how you're really feeling inside. After a heart attack, it's easy to focus only on the physical side of recovery: the pills, the appointments, the treadmill, and rehab. But what about the part that lies a little deeper: the emotions that sneak in when the house gets quiet, Or when you find yourself hesitating before going up a flight of stairs, wondering if your heart will hold up. Here's something you may not have been told: it is completely normal to feel anxious, sad, or even angry after a heart attack. You might feel guilty for not recognizing the signs earlier, or scared that it could happen again. That fear, that feeling of what if, can quietly shape your days if it's not addressed. Let me introduce you to Melinda, a 70-year-old retired librarian from Vermont. On the outside, Melinda looked like she was healing beautifully, walking more, eating healthier, showing up to every checkup. But what her doctors didn't see was how she sat alone at night, replaying the moment it happened. She didn't tell anyone about the panic attacks that made her afraid to leave the house. It wasn't until her daughter gently encouraged her to talk to a counselor that Melinda realized this emotional weight was not hers to carry alone. That single step to open up was what truly jump-started her recovery. The American Psychological Association reports that up to one-third of heart attack survivors develop symptoms of depression, and many experience post-traumatic stress symptoms. But here's the good news: people who talk about these feelings, whether with a therapist, a support group, or even a trusted friend, often recover faster and report a better quality of life. You don't have to lie awake in fear. You don't have to pretend you're fine just to make others comfortable. Healing your heart also means healing your mind. Ask your cardiologist or primary care provider if there's a cardiac support group in your area. Many hospitals offer them. Or speak to a mental health professional who understands cardiac recovery. Sometimes just saying aloud, "I'm scared," can begin to loosen the grip that fear has on you. Now, while we're on the topic of self-kindness, let's talk about something that feels small, but is surprisingly powerful: your food. Not a diet, not a full kitchen makeover. Just small, sustainable changes that your heart and your taste buds will thank you for. Because here's what often happens. After a heart attack, we feel this overwhelming pressure to overhaul everything, throw out the salt, banish butter forever, and survive on dry salad and boiled chicken. But you don't need to punish yourself to heal. You need to nourish yourself. And it starts with one simple shift at a time. Let me tell you about Charles, a 76-year-old jazz musician from New Orleans. After his heart attack, his doctor told him to cut back on sodium and saturated fats. Charles tried going cold turkey, no Creole seasoning, no fried foods, just steamed vegetables and grilled fish. He was miserable. "I didn't even want to eat anymore," he said. But then a dietitian helped him take a different approach. Instead of eliminating everything, Charles started by swapping white bread for whole grain, using herbs like garlic and smoked paprika instead of salt, and grilling his catfish with a spicy rub that didn't need butter. He even found a low-sodium hot sauce that made him feel like himself again. And guess what? 6 months later, his cholesterol was down, his energy was up, and he was back playing late-night gigs with a healthy snack in his saxophone case. Research from the Mayo Clinic shows that adopting a heart-healthy eating pattern, like the Mediterranean or DASH diet, even one step at a time, can reduce your risk of another heart attack by over 30%. That's huge, and it doesn't have to mean bland or boring. Start small. Maybe it's switching from canned soup to homemade with low-sodium broth. Maybe it's trying olive oil instead of butter. Maybe it's just eating one more serving of vegetables a day. The key is consistency, not perfection. And don't forget to give yourself grace. If you had a slice of birthday cake or grabbed a burger with friends, that's okay. One meal doesn't undo your progress, just like one healthy choice doesn't fix everything overnight. But every choice adds up. If you're still watching and finding these lessons valuable, please comment the number 1 below, just so I know you're still with me. Your time is precious, and I'm honored to be here with you on this journey. And as you keep taking these steps through rehab, medication, emotional healing, and better food, there's one more piece that ties it all together. One that often starts with just 5 minutes a day, but has the power to bring back your strength, your energy, and your trust in your body again. Because now it's time to move again. And I know what you might be thinking. Move. I'm still trying to breathe easy walking to the bathroom. Or maybe your legs feel like they're made of lead, and the idea of exercising feels far away, maybe even frightening. That's okay. Movement after a heart attack isn't about going to the gym or running marathons. It's about rebuilding trust with your body, one gentle, confident step at a time. I want you to meet Elaine, a 73-year-old grandmother from Oregon. After her heart attack, Elaine was terrified of walking outside alone. Every twinge in her chest made her panic. She avoided the stairs. She skipped family outings. It was like my world had shrunk, she told me. But one day her grandson, 6 years old and full of energy, asked if she would walk to the end of the block with him to find pine cones. Just to the end of the block. She hesitated, but she said yes. They walked slowly, hand in hand. She felt her heart beating faster, not from exertion, but from hope. That walk changed everything. The Cleveland Clinic reports that even 30 minutes of light movement, like walking 5 times a week, can reduce your risk of future cardiac events by over 20%. It improves circulation, lowers blood pressure, strengthens your heart muscle, and boosts mood. But perhaps even more importantly, it gives you your confidence back. Start where you are. For some, that's 5 minutes around the house. For others, it's stretching in a chair or gently pedaling a stationary bike. Use a smartwatch or a simple timer to help track progress and celebrate every milestone. That first walk around the block, that counts. That time you chose to stand instead of sit for a phone call, that counts too. And if you feel uncertain, check in with your cardiac rehab team. They'll help you set goals that are safe and realistic for your stage of recovery. The goal here is not speed, it's steadiness. Because this journey isn't a sprint, it's a new chapter. And each gentle step you take is a line you're writing in the story of your comeback. Let's take a moment to pull everything together. You've faced something life-altering. You've been through fear, fatigue, and perhaps even moments of doubt. But you've also shown courage. By embracing cardiac rehab, taking your medication seriously, opening up about your feelings, making small but powerful food changes, and beginning to move again, you're building a foundation that not only supports your heart, but strengthens your entire life. You are not starting over. You are continuing smarter, stronger, and more aware. Now, before we wrap up, I promised you a simple 2-minute trick that could change the way you sleep and recover. And here it is. Every night before bed, sit quietly with your feet flat on the floor. Close your eyes. Place one hand on your heart, the other on your stomach. Slowly inhale through your nose for 4 counts, hold for 2, and exhale through your mouth for 6 counts. Do this for just 2 minutes. This breathing exercise activates something called your vagus nerve, which helps slow your heart rate, lower your blood pressure, and calm your nervous system. Studies from Harvard Medical School show that this kind of deep breathing can reduce stress hormones by up to 30%, improve sleep, and even support better heart function over time. And perhaps just as important, it reconnects you to yourself, not the patient, not the diagnosis, just you. Remember, recovery isn't about doing everything perfectly. It's about doing the next right thing, one choice at a time. So what was the one lesson today that really hit home for you? Please share one habit you plan on adopting in your life. I'd love to hear from you in the comments. Your voice matters. Your story matters. And if this video helped you in any way, please take a moment to like it, share it with someone you love, and subscribe to the channel for more heart-healthy wisdom and support. We've got so much more to explore together. Here's to living your best life, stronger, wiser, and more joyful than ever, at any age.